Hi, my name is Dallin, and I'm actually going to be presenting today about Mountainlands Community Health Center. So to get right into it, what is Community Health Center? Basically, what it is a primary care facility that reduces barriers such as cost, insurance, language, distance, things like that. For Mountainlands specifically, this is their mission statement, and what they do to kind of reduce those barriers is they offer a lot of uninsured care, discounts, and a lot of their employees speak Spanish and other languages. So these are the different clinics that we have. We have two in Provo, one in Payson, one in Vernal, and we actually have a East Bay location that primarily helps our homeless patients. Right here, we have 2021 data. So total patients, about 21,000. We have the different ages. Prenatal care patients, that's the pregnancy patients. We can see that we almost had about pregnancy or birth every day. Here's some more data that is really pertinent to our public health vantage point. So we see about 58% are uninsured. I'm going to skip those the next two. 74% are a minority, 70% are Hispanic Latino, and 55% are best served in a language other than English. So, like I said, Mountainlands does a lot and they speak a lot of Spanish there, hence the 70% Latino. But those other two right there about the poverty guideline is really, really interesting. So, I want you to pay close attention to that 100% is at 62%. So basically what that means is that if you're a single person, you are making less than $12,000 a year. And that's not very much. And Mountainlands knows this and knows that medical care is very expensive. And so they actually have these discounts. So if you're making about that, you'll be only paying $30 for every service. So what that means is the appointment that you have, all the exams that you do within that appointment, everything that you do is only going to be $30. For every appointment, it's going to be $30. But yeah, and they also have dental and psychological care things right there. And we'll get into that with our different services. So medical, you just think of like your basic primary care things. So pregnancy stuff, immunizations, medical exams. They also do a couple of little procedures like vasectomies and IUD insertions. They also have dental and these locations I marked right here, different dental things, cleanings, exams, fillings. They also provide mental health services like a psychology and counseling. And these are the different things that they offer right here. Pharmacy, this is a really big one. So Mountainlands is a community health center. They participate in the 340B program. And basically what that means is that pharmaceutical companies are required by the government to give community health centers like Mountainlands money to provide discounted or even free medication. What that means is for a patient, I actually asked them in about a year before Mountainlands, they were paying about $4,800 a year for their medication. Now, because of this 340B program, they're only paying $800 a year. So a fraction of the cost, thanks to this program that Mountainlands is participating in. Now, they also offer health education and financial advocate services. So they're educating these people about how to take control of their health and to improve. And also, they have these financial advocates that really try to help that 58% of uninsured patients get the health insurance that they need, and also make payment plans for those that do not have insurance for pregnancy and prenatal services. So that's just about the basics of what Mountainlands provides. If you have any questions, feel free to give them a call, and they'll be more than happy to help you. Thank you so much.